Hi everyone, my name is Catherine Corcoran and welcome to the ONG BST Induction Day. So today we're going to have a few short talks for you. The first will be from your National Specialty Director, Dr. Izzy Cladd. The second will be from myself and I'm going to talk about your e-portfolio, how to navigate around your e-portfolio and how to log forums. I'm then going to show you how to log into the RCPI website and how to book onto courses. Then I'm going to talk to you about your assessments and what the NSDs usually look for during the assessment period. Finally, we have two trainees who are on the BST programme and they're just going to give us a little insight of their experience on the BST programme. Hi everyone, so if you have any questions throughout the talk, if you hover over the bottom of the screen, you should see a little Q&A section there, and you can just type in whatever question you have and we'll answer them all at the end. Okay, thanks.
Hello, good afternoon. My name is Dr. Izzy Cladd. I'm a consultant in University Hospital Waterford and I'm one of the NSDs for the BST programme for Obs and Gynae. I work alongside Dr. Doireann Kent, who is working in the Rotunda Hospital. So first of all, congratulations and welcome aboard onto the BST programme. As you know, this is a 3-year programme involving 2 years as an SHO, rotating between posts assigned within the hub of your choice. And the 3rd year is in a junior registrar capacity, which will involve another competitive interview process, ranking and posting according to your preferences again. So in terms of the structure of the programme, there are 2 NSDs, which are myself and Dr. Doireann Kent, and each hub has a hub coordinator as well. So you are all at this stage assigned trainers, and if there's any problems, you can report to your trainer or to your hub coordinator as well. What I would encourage is that if you meet your trainers early, say within the first 4 to 6 weeks of starting your rotation, to just outline your personal goals and aims for the year as well. So the beauty of the BST programme is that it provides structured training and a broad exposure to obstetrics and gynaecology in general, and ensures that you rotate through the various subspecialities as much as possible. This will ensure a natural progression in terms of your clinical skills and knowledge, and by the end of the BST scheme, most people will be relatively comfortable managing common presentations in obstetrics and gynaecology, and relatively confident managing a busy labour ward with indirect supervision. The curriculum in the BST will cover all these aspects as well, and are realistic as well to achieve within the first 3 years of training. There are mandatory courses and study days that you're expected to attend as well. Some of these mandatory courses are specific to obstetrics and gynaecology, and some of these courses are a little bit more general, but are very equally important to build up your character as a good clinician as well. In general, throughout the year, there are 6 to 8 study days run by the college, and you're expected to attend at least 4 of these throughout the year. Things are a little bit different this year with restrictions because of COVID, and we're trying to work around a blended approach of delivering these contents. One of a very important course that we tend to run in the first few weeks of starting the BST is Basic Surgical Skills course. So again, we're looking at this to be delivered in a more blended approach, but one of the most important skills that you need to achieve from this is your suturing and knot tying. What we've decided to do is that this year this will be delivered locally, either within your hub or within your training hospital. Your hub coordinators and trainers will have been informed of this. This will be added onto your logbook as well and needs to be signed off in the first 8 weeks of your training. So in terms of examinations then, generally most trainees would have passed their Part 1 MRCOG in the first year of the BSc scheme. During the second year, you're encouraged to do the diploma in women's health run by the college. And by the end of the third year, you are expected to have passed your Part 2 MRCPI in Obstetrics and Gynaecology. This is a requirement to obtain your BSc certificate and is also a requirement to proceed to your HSD application as well. With regards to assessments, we usually arrange assessments towards the end of your training year prior to progression to the next year. So usually it's run around February or March. But specific to the first year BSTs, we're also arranging a check-in call around November, December, just to make sure that you're all finding your feet and getting comfortable in your new post. We all understand it can be very daunting in the first few months where you're just learning the system and also trying to apply all this knowledge that you knew from medical school into clinical practice as well. We all know that it's a very steep learning curve and there's so much skills that you will learn in the first few months of your rotation, but you will learn a lot from everybody around you, your registrars, your consultants, your fellow midwives. Everybody has been in the same situation and everybody is keen to help you learn as well. So don't ever worry about asking people around you. So I suppose that's a brief overview of how the programme runs. I'd encourage you to meet with your trainers early, have your aims set for the year in terms of exams, what skills you want to obtain, which study days you need to attend, have that all clearly delineated in the first few weeks of starting off, just to have a clear plan of how your year should run. And again, it's a steep learning curve. You will not know yourself this time next year in terms of the skills and the knowledge that you would have obtained compared to where you're starting off now. And don't be ever afraid to ask for help or ask for advice. So good luck, welcome on board to the scheme, and I'm happy to take any questions at the end of the day.
Okay, so that was from Dr. Azy Cladd, and she is the National Specialty Director for the BST programme. So next, I'm going to talk about the e-portfolio and also your assessments as well. Okay, so just with the governance, the Dean of Postgraduate Specialist Training is Professor Colin Burgeon. The National Specialty Directors are Dr. Azy Cladd and Dr. Aileen Kent. There's also a list of hub coordinators there for each hub that you are already assigned to, so it's just handy to know who these hub coordinators are. So today we're just going to focus on 3 elements of your BST programme. So we'll be looking at your learning opportunities, recording your training through the e-portfolio, and your assessments. And then in the coming weeks, you will have separate webinars specifically relating to examinations, courses, and your curriculum. So the first thing to know is about your digital hub. This is through the RCPI website just by logging in and entering your username and password. If you have forgotten your password or you're having difficulty, you should email helpdesk@rcpi.ie. So just by looking at the screenshot here, you can see that you have access to a lot of information here. So you have examinations, so they will have examination dates, upcoming examinations for the year, training. So if you need any further information on the BST program, you can look at additional information on the BST program there. Course coming up, this is where you need to book them, and you can also view them as well, anything that's coming up in the near future. If you look down at the digital services part, so there are links there to your ePortfolio, to your courses and events, and to RCPI Brightspace. So this is all courses and events are free. You need to register through the digital hub to access your mandatory courses and your study days. It's also really important that you book early as well, as there is usually a waiting list for events. So this is what Brightspace looks like. You can see at the top of the screen there are mandatory and recommended courses for the BST ONG programme. So you usually find that within your specific section, and it gives you a list then of all the different types of courses that's required for year 1 and 2, and will give you the next upcoming dates where you can book there through Brightspace. So Brightspace is accessed through your digital hub. It's a new environment. There's content for courses both online and offline. You can also book your study days here, and then there are online courses that can be completed. Feedback and certificates of attendance following the event are also available on the RCPI Brightspace. If you have any problems trying to book onto any of the courses, you can just contact the courses department on their email address. And what I'll do at the end of this presentation, I'll give you a list of all the contact details of all the relevant departments should you need to contact them at any stage. There's also a calendar within there as well. So it's just a handy way, if you booked a course or an event, you can save it in your calendar so that you know anything that's coming up, and it also sends you a reminder as well of courses that you are currently booked onto. So next is your ePortfolio. The ePortfolio is called Kaizen. Again, this is accessed through the digital hub where it says new ePortfolio. So you just need to click on that, and you can click on it via your mobile or your desktop. This is where you record all of your training activities. So as you progress through your training years, you're expected to meet some minimum requirements. And we'll go over this again in a little more detail as we go on. It's also very important that your trainer is assigned to your logbook. You just need to email myself and I'll add that to your logbook. So here we have a screenshot of what your logbook will look like once you have access. So just to the left-hand corner there, you will see this is just a test account here. So you will see this trainee, she is currently on the BST ONG programme. The start date and the end date are correct for the 3 years. There is an expand for previous information, so there won't be anything there for you at this particular time, and that you're in the correct intake year, that your medical council number is correct, your year of enrolment is correct, and your RCPI ID is just at the bottom. That's where you'll find it. So when you're then assigned to a hospital, it will directly under the training program, it will give you the hospital name. So you just need to check to make sure that the hospital name is correct, and that also there is a trainer assigned to you as well. And again, if there isn't, you just need to contact myself. Your inbox, so this is where you will have all kind of, I suppose, up-to-date information on your e-portfolio. The next is your training curriculum. So this is where your current training curriculum is, and you can click that just to see what your minimum requirements are for the year. If you click here on the training requirements section, it'll bring you straight into your progression view. And so you can scroll down here and see your first 2 years and for your third year of BST as well. So it's clearly marked out. If you look at the assessments part, OSATs for year 1 and 2, you click down, you will see that there are a certain amount of requirements that need to be completed within your first 2 years. So you just need to make sure that you're meeting these requirements and that you're entering the forms in. Some of these are highlighted in a bright blue and others shaded in grey. Anything that's blue means that it's required within either year 1 or 2 or required in year 3. If you click on year 1, all of these are shaded, but you now have highlighted your CBDs, your mini CEX and your end of post forms. So these forms are what are required per year, and it's just important to see the numbers here at the end. So when you complete a form and you have met all the requirements, see over on the right hand corner that this then turns to green. For year 1, end of post, there is 1 required. Because your mandatory courses are all to be completed within your 3 years, that would be in the training programme part, whereas in year 1, all that's required are in-house activities, study days, delivery of teaching, presentations, meetings and additional qualifications. The first thing you will need to do when you start is you will need to put in your personal goals for the year. Meet with your trainer, come up with some goals that you would like to have achieved by the end of either the current rotation or by the end of the year. So in order to find these forms, you click up at the top right hand corner and there's a little plus sign here, just click that. You then look for the forms that you need. So again, if it's a personal goal form, you click on the personal goal form. Because today is your BST induction day, you can actually mark today down as a study day. All you need to do is click on the form, enter in all the details, make sure the date is incorrect, the type of study day, the title of study day, and then just click submit at the very top. Once that's submitted, it then shows up on your training requirements or your progression view. And if we scroll down to year 1 study days, you'll see that it has been added here. So filling out a form. So you'll be asked to fill out forms where you need a trainer sign off. These forms would be an OSATs form, CBD forms or mini CEX. This is why you need to have your trainer assigned, as when you're filling out this part of the form, at the very bottom of the form, there will be a part where it asks you to fill in the next section. You type your trainer's name here, and then you submit it. The important things to follow up on is to make sure you check your post and your trainer details are correct on the ePortfolio, that you meet with your trainer and agree goals for your post, you complete your personal goals form on the ePortfolio, you record activities on a regular basis, and then you complete your quarterly and end of post forms. It's also important that you submit all records before finishing in that post, as you will not be able to do so when you've moved into your next post. Also in the Digital Hub we have online journals, research services and reward schemes. Now for the assessments, so generally we have year 1 assessments around November, December times. This is more of a check-in time just to make sure that you're on track, that you're able to use your ePortfolio and that you're beginning to meet your requirements early. There may be a second assessment in the new year around January or February time, but I will let you know later in the year dates set for your assessments. Year 3 assessments were normally in November, December time, but this may be changed to April or May. Year 2 assessments are normally in late January and early February. This is because you will usually have your Year 3 recruitment interview at this time. The structure of the assessment is that you will have a formal review with your NSTs. They usually go through your e-portfolio here. It's really important that you keep up to date with your e-portfolio and that you're logging all activities on a regular basis. Progression is dependent on a satisfactory outcome. Again, this is based on your e-portfolio entries and your trainer report as well. As I said, the Year 2 assessment is combined with the Year 3 recruitment interviews, and this is at a very competitive entry. So if there's an outcome where the NSDs do not feel you're ready to progress, they will have remedial measures in place to allow for an interim assessment later on in the year. So here we have the O&G life cycle for Year 1 and 2. So both years you have a 6-month post. In each of these posts you need to review your curriculum, meet with your trainer and set your goals. Start thinking about your exams and study days, and also make sure that you have your courses booked as well. Year 2 then, the important thing to think about is preparation for your Year 3 interviews. You need to review your curriculum, meet with your trainer, think about exams, study days and your courses. Year 3, junior register level, again, review your curriculum, meet with your trainer and start thinking about HST interviews, which are usually around February or March of each year. So getting started, the first thing really would be to get to know your curriculum, meet with your trainer and set your goals, get to know the RCPI digital service and start using your ePortfolio straight away. It's also a good idea to log into RCPI Brightspace and research on your mandatory courses. There are also other learning opportunities available to you, and anything additional I usually email out to the trainees throughout the year. It's also good to start thinking about your exams and start planning early. Finally then, just to make sure that you have everything recorded for your requirements in your ePortfolio and they've been signed off by your trainer. Certification usually follows by a certain exit criteria, and these are ensure that all the minimum requirements listed in your curriculum have been met, that your post-assessment form is signed by each of your trainers in your portfolio, that you have passed the MRCPI exam and that you've uploaded this diploma into your ePortfolio. Also upload all of your mandatory course certificates to your ePortfolio. Supports available then are really your trainer, your hub coordinator, the site trainee rep, the national specialty directors, the trainees committees rep. Then you have the postgraduate medical education centre or courses. You have medical manpower and occupational health, the HSE workplace health and wellbeing services, and your training post evaluation at the end of the year. We have other contact details for South-West Hospital Group, the Shalta Hospital Group and UL Hospital Group. Finally then, I have just added my own contact details there. There's also the exams coordinator, Virginia, and then finally we have Neve, who looks after the online courses for the BST.
Hi everyone. So I just want to point out some of that presentation is cut out. So what I might do is I'll send you all an email of the presentation afterwards, so just so you have all the contact details. So next we're going to listen to one of our trainees, Dr. Doireann Roche. She's currently a Year 2 BST trainee, and she's just going to give you a little bit of insight as to her experience of her first year on the programme.
Hi everyone, my name is Doireann. I am a second year Obs and Gynae SHO as of today, Monday, and I've been asked to just give you guys a little chat, kind of talking about the assessment that you're going to have, and to kind of boost morale and say welcome to the scheme. Okay, I've made a little PowerPoint. I think you can see it, so I'm going to give this a whirl and then we'll get going. So who am I? Like I said, my name is Doireann Roche. I'm a second year SHO, currently working in the National Maternity Hospital. I did the first 6 months of my scheme in Kilkenny, and now I'm in Holles Street, and I'm staying on in Holles Street for the next 6 months. I've absolutely loved my first year. I can't recommend it enough, and all I can say is welcome to the scheme. So yeah, like I said, I've been asked to kind of talk to you about your assessment. You might not even know what that is yet. But it's basically an informal kind of meeting to assess your progress that you'll have in kind of November, December time. And I'm just going to give you some tips on how to prepare for it. So in my opinion, to prepare for your assessment is to prepare your e-portfolio. So your e-portfolio is where you log all of your clinical activities and basically everything that you do on the scheme, whether it's surgical skills, communication, discussing cases, ultrasounds, procedures, research projects, any exams that you'll sit, anything like that. So I think as a starting point for the scheme, if you can get familiar with your e-portfolio over the first month, get to know your trainer. It's really important that you figure out who your trainer is. It's usually assigned, or you might have the opportunity to pick your own. But sit down and meet with them and kind of go through all the things that you need to get signed off so they're aware. And then also just to familiarise yourself with the online system. One thing I'll say is start as you mean to go on. So I would say in an ideal world, we'd all come home from work and fill it out every day, but life is not that organised. Well, for me anyway, it's definitely not. So I think a realistic approach should be to pick one day a week where you fill everything out. And I really want to put emphasis on don't forget the small things. So I found we had a tendency, myself and my co-SHOs, we'd remember things like hysteroscopies, closing the abdomen, all the big things, kind of theatre-based or clinic. But we'd forget smaller things such as like educational sessions, teaching, MDT attendance. And they were things that we were pulled up on in our own assessment. So just to remember that you have to fill in everything and just try and make a habit of doing it once a week so that you have a nice, beefy, chunky, filled out e-portfolio that you can get to your assessment and brag about. So the actual assessment itself, it's an informal meeting, and the idea is to discuss your progress. They really start off by reviewing the e-portfolio that I've mentioned. So again, I can't stress enough, have everything filled out. You don't want to spend your assessment explaining that you actually have done things but just haven't filled it out. Instead, just have everything filled out and have an e-portfolio that you're really proud of. This is also an opportunity where you could flag any concerns. So if you feel like you're at the place where you were working isn't allowing you to kind of reach the milestones that you should be as a trainee, it's really important to flag that so then it can be brought up for future trainees. Also an opportunity to discuss any projects. So if you're doing kind of any audits, research or quality improvement, be proud, and this is your chance to show off and talk about it. And again, this is an opportunity for the training body and the people that you meet with to kind of say, look, you've done really well from like a surgical skills point of view or from a research point of view, but you're falling a little bit behind in this area. So just to make any recommendations so that you can improve for the year going forward. So I'm not going to harp on forever, but I would just say in a nutshell for your assessment, it's really laid back, really chill. Everyone in our year came out really happy, but just be organised and go in with an e-portfolio that you can be proud of. And just in saying that, to do that, just fill everything out that you do. Just be on top of filling it out. Okay. Finally, I just have some kind of top tips that I would tell myself 1 year ago. Always ask for help if you need it. It's so important in obs and gynae just to know when to escalate care to a senior and have a really low threshold for doing that. Again, as I've said it a million times, just keep on top of your e-portfolio and you won't regret it. Build a good rapport with your trainer. I think that's really important because they can kind of push you to kind of progress if they know where you're at. And it's also just a really nice kind of relationship that you can have. Most of all, just have fun, enjoy the scheme. I'm loving life. I can't recommend it enough. It's definitely been a strange and weird time with COVID, even just for the very fact that I'm sitting here in the kitchen talking to myself, which is a bit odd. But sure, hey, we've all grabbed the bull by the horns and just gotten on with it, haven't we? So yeah, just have a good time, enjoy it, and I'm looking forward to meeting everyone, which I'm sure I will over the next few years. Thank you and best of luck.
Okay, so next we're going to play a recording from Dr. Gillian Corbett. Gillian finished her BST last week, and she's currently now on the HST scheme. So she's just going to give you a very broad overlook of the scheme in its entirety.
Hey guys, how are things? I just wanted to give you kind of a little run through about someone who's just finished the BST. My name is Gillian Corbett. I'm one of the Year 1 SPRs on the Higher Specialist Training Scheme in Holles Street. I've just finished the BST, and so basically, you'll probably know most of this anyway from applying, but the basic training scheme obviously is 3 years. So you have 2 years as an SHO and 1 year as a junior reg. Now, for things that you should know about what will be coming up, you have an annual assessment each year that looks at your e-portfolio and your kind of progress with it during that year. And that will happen in first year, and then in around November usually. And then in second year, you'll have a second year assessment. Where they will kind of, it's like a little mock interview, and then you're re-ranked at that point, and then your junior registrar preferences will be based on the ranking that you do. It's usually early February of second year. So that's kind of like, you know, your first big kind of competitive milestone, and it's an opportunity for you at that point to, you know, refresh your CV, have a look at what you have and what you do, and most importantly what you don't have, because your next competitive assessment will be the following November and then February of third year, where you'll be applying for the SPR if that's the direction you want to go in. So that's kind of how it breaks down. Lots of people will be changing every 6 months, and some people will be staying on in one place for a year. So what I would advise you to do when you start, like RCP, I always tell you to do this, but you know, when you get somewhere and it's really busy, sometimes you still don't manage it, but you have to sit down with your RCPI trainer, which is often your consultant on whatever team you're on, and kind of make a training plan. So that you know, it's kind of self-explanatory. The main things that you'll be focusing on are, you know, getting competent in doing basic procedures, getting competent in performing scans, maybe doing a little research project, kind of basic things that are targeted at your level. But what it just helps you become very focused for that 6 month period and what you want to get out of it. And then at the end of that, it's satisfying. You say, look, I'm well able to do that now. And then you can kind of monitor your own progression. But I would really advise you to do that in the first week or two, because after that, things will get busy and it will be like an afterthought. You have to do it in the first week or two. And all the consultants are expecting that you will initiate it. They are not going to initiate it. You have to ask them, look, can I catch you at the end of your clinic? Can I catch you between cases in theatre? You have it ready on your laptop, so it's all ready to go and easy for them, because their time is precious and they're not going to spend an hour or two going through this. It needs to be a 5 or 10 minute slot that you're prepared, you have done your homework, and you just have to walk them through what you want to do, and they will give you feedback on what will be helpful or how to achieve it. And, you know, if they see you are focused on something, or that you are, like, say you want to get good at scanning this 6 months and you want to competently do a abdominal circumference and head circumference by the end of the 6 months, like, that is a really useful thing to learn. I would very strongly advise you to make that one of your focuses for the first 6 months, because accurately doing that will carry you through your whole training. And equally, if you're doing it wrong, it will catch you out at every turn. But if they see that you want to do that, they may suggest that you should go to the scan department. They may know someone in the scan department. They may ask you to come in and scan with them. All that kind of stuff comes out of you saying, look, I want to be competent in doing this by the end of the 6 months. So just be focused on it, be very clear on what you want to do. If you're not sure, ask an SHO in the year ahead of you, ask the junior reg, what's good for me to be looking at or trying to be competent at this stage. And kind of what goes along with that is your e-portfolio. So the e-portfolio is it's kind of daunting to learn how to use to begin with, but it's very, very useful because it kind of gives you an idea of what you should be able to do. And, you know, there's different procedures that are targeted for each year on that new e-portfolio. That's kind of a general guide. It's not it's not an exact art. And, you know, lots of cesarean sections are listed as year 1 or year 2, but cesarean sections are a whole spectrum of complexity. And obviously you wouldn't be doing a preterm cesarean section with placenta previa in first year, where you would be doing like an elective primiparous cesarean section in a breech for a breech presentation. That would be a more appropriate cesarean section for first year. So they're not exact, but they do give you an idea of what you need to be doing clinically. So they are all found on, each of the clinical procedures are found in BST ONG procedures, and then they have all the lists of them there. And the other thing that you need to be keeping an eye on is the OSATs. So the OSATs are like, I can't remember what they stand for, but they're the kind of objective assessments that you're able to do, the procedures or the tasks that are set out as a kind of a standard expected competency of a BST trainee by the end of it. So keep an eye on those. There's a minimum requirement for each year. So you need to kind of keeping an eye and make sure that you're at least making progress towards completing them. Equally, that you see, look, I haven't got those, I need to keep an eye out for this kind of procedure, or look, I haven't had any hysteroscopies, but I know on Thursday morning there's loads of hysteroscopies on that list with that consultant. Maybe I could approach the person who manages the rota or that consultant themselves to ask me to let me assist on that list so that I could do a hysteroscopy or two and then get an OSAT out of it. So that's the kind of thing you need to be kind of switched on. If you want to figure out what you need to do and what you haven't done yet, on the e-portfolio, there's progress bars down under training reports, and each of them have these little, so you have each of the areas with, you know, their overall training scheme, and then year 1, year 2, year 3, and they'll have bars. So the bars will go green if you've completed the minimum requirement of them. That's a handy tip now for your assessments. Green bars are what you need. But, you know, equally, if it's empty or if it's orange, that means that you haven't done enough of them, and you need to be kind of on the watch for them or on the hunt to complete those. The other things with the e-portfolio and kind of the basic requirements of the BST are the compulsory courses. I would say to you, keep an eye on them, look up at the diary for the year. They're hard to get spots in, and you need to be really kind of switched on, you know, that you don't get invitations to invite you to the courses. You need to be kind of watching, okay, look, there's a course next May, and you need to go into your RCPI account and register for the course, rather than you get an invitation by email from RCPI. It doesn't work like that. You have to kind of go and look for it. So kind of do that maybe every 6 months, so that you know that you have upcoming your family planning course, your communication course, your leadership course, they are going to be on this date. And equally in your assessments, if you haven't done them yet, you'll be asked what's your plan to get them done. So you need to kind of be switched on about that. Other things are like study days. So the Institute of Obstetrics and Gynaecology, that's the kind of the national committee of obstetricians, who kind of guide best practice in this country. And, you know, lots of your consultants in wherever you're working would be on that. It would be involved in the Institute, and the Institute developed the guidelines for clinical practice in Ireland. So their website is very good. They have lots of guidelines on the website, and they will have study days in September usually, and there's one again in May, so a spring and autumn meeting. And they're very good. They have lots of interesting talks and you know, experts coming in and talking on like subspecialty areas, and that's usually a very good meeting to go to. It's one day. The other annual meeting that you'll want to keep an eye out for is the JOGS meeting, which is usually the last weekend in November. So it alternates between JOGS and then an Irish Congress each second year. But the JOGS one is on every year. It's built into the Congress every second year, and then every other year it's just the JOGS conference. So it's the Junior Obstetrics and Gynaecology Society. If you are not on that mailing list, please email the JOGS Gmail address. I think it's on the JOGS website. If you look up JOGS Ireland, you'll get it on the website. Email to me. I'm the secretary, and I'll add you to the mailing list so that you can be in the loop, because a lot of the training things and the courses or conferences will be emailed out to the JOGS group from that mailing list. And if you're not on, obviously you don't get the information, you can't keep up to speed. So The conference will accept abstracts and for poster and oral publications. The abstract deadline is usually the end of September, sometimes early September. So it's good to start thinking about that. You know, if you want to have something in for JOGS this year, you need to start thinking about what will I do and how will I progress it so that you have your abstract ready by September. Go for oral presentations if you can. They are very good experience. They're good for like learning how to speak in front of people. They're good for like settling your nerves when you're, you know, need to perform under pressure. And they're good for really making you think about what you're doing and why you're doing it, and presenting, and most importantly, getting your research into kind of a more public arena. I suppose the other milestones that you should look out for during the the BST are the MRCOG Part 1, which you have to do in order to do the MRCPI. I would advise you to do that as early as you can. Do it properly. Spend 3 months studying for it, do it once, pass it and move on. There's a very good revision book called Revision for Obstetrics and Gynaecology. It's like a little white book with an embryo on the front, and that was what I used for studying for it. There's an official RCOG book, but it's a bit long-winded and hard to keep track of. So I would advise that revision book. The other exam that you can keep an eye out for is the Diploma in Women's Health. Now, that used to be like a one-day short paper, kind of paper that you wrote over 3 or 4 hours, but now I think it's changed to online modules. So have a chat to your supervisors and your seniors. It's designed for general practitioners, but historically it has been good for getting people prepared and getting a bit of practice in before doing the MRCPI. So it's another thing to kind of consider, you know, especially if you're in first year, you've already done the MRCOG and you want to kind of study for something or be kind of keeping in with some kind of like curriculum. That's a good one to keep an eye on. And then the MRCPI then is the big one that you want to have passed by the time you finish your BST. For the MRCPI, you should be looking at the Institute guidelines, the green top guidelines of the RCOG, NICE guidelines, TOG guidelines. TOG is the obstetrician gynecologist. It's like the journal associated with the RCOG. And all of that is kind of examined on the MRCPI. So you have a clinic, you have a academic, like a written paper, MCQ paper with 100 questions, and then 2 months later, if you pass that 2 months later, then you'll have your OSCE or your clinical exam, which is a series of short cases and then a long case. So that's very good to get out of the way before you start junior reg if you can. If you can't, you just sit it in junior reg, and it complements everything you're doing in junior reg anyway. Other things to consider doing or adding to your portfolio is masters. So lots of people do masters in a variety of things. I suppose it's the academic advantage of it is if you have it completed by the time you're applying for SBR, you will have points for it. If you don't have it completed by then, you won't get the points. You'll only get whatever you get kind of academically out of the masters. So my advice to you would be to have a think about what you would like to do in it. There's masters in obstetrics and gynaecology run out of Cork that might be discontinued now. Just look into it if it's something you're interested in. There are masters in clinical education that you could do, and there's masters in research, leadership, management, all that kind of stuff. So I would advise you maybe to have a think about it if you want to do one. Look up all the different universities and the master's options that they offer. If there's something that you see that you think, look, that would actually really help me, I'd really enjoy it, then consider doing it. And maybe ask your trainer, look, do you think this would be a good idea? If it's a lot of money, usually they're like, you know, between 8 and 10 grand for like a 1 or 2 year masters. That does come back to you though kind of long term, because once you have graduated from the masters, you'll move up a pay grade, and you know that will over a couple of years pay back itself. So I wouldn't let the money deter me, but I would only do one if you think I would be interested in it, I know I'll enjoy it. Don't do one for the sake of doing it if you don't think you're going to really get anything out of it. And if you have made that decision in first year, apply for it in first year so that you'll have finished it by third. So then in terms of leadership and management are the other things you need to keep an eye on, because that will be asked in your second year assessment and in your SBR interview. You'll need some kind of experience in management and leadership and how you're kind of developing those skills. So they could be both medical or clinical or non-clinical. So, whether or not it's you're the captain of your football team, or you're kind of the manager in your part-time job that you had before, or like one of my friends was the manager in her family business, and that's the example that she used. I did the lead NCHD in the COOM in my second year, and that is what I kind of used as my leadership role. So the lead NCHD, each hospital will have one or two positions. Sometimes they do two people as the same one every 6 to 12 months, and the hospital will invite applications for it. You have to interview. It's a competitive process to get it, and I think what they're doing now is they do if you're at the lead NCHD, you get a leadership diploma. Think about it. If you're applying for lead NCHD in your hospital, I would advise you to think about it, make a plan, go into the interview prepared. You won't get it if you're unprepared properly. The other things that you can use for leadership and management things are being on the NCHD committee in your hospital, being an RCPI training rep, or being involved in any of kind of the committees within the hospital. So kind of ask around in your hospital. There'll definitely be something somewhere that you can get involved in that you can make your own, and that will be your thing that you learned your management skills from. The other clinical tips I would give you kind of for starting the job is to read as much as you can. So I would advise you to do that. I would advise you to be as prepared as possible, read as much as possible. If you know you're covering the emergency room and you're going to be covering any patients who are coming in with miscarriage or ectopic pregnancy, so anything like that, read up on them. Learn the criteria for diagnosis for an ectopic or miscarriage. You won't be diagnosing miscarriage or ectopic as an SHO, but if you know the criteria, it will empower you to direct the care properly. It will empower you to escalate it appropriately to whoever you think needs to see or know about this patient, and it will just make you feel more comfortable in assessing the situation, because look, what is really serious and what's not. So again, all the clinical guidelines that you would use commonly are ones from the Institute, ones from the RCOG, the NICE guidelines, the Obstetrician and Gynaecologist guidelines, TOG guidelines. Contraception ones, the really good one is the Faculty for Sexual and Reproductive Health. It's a UK guideline, and it is excellent. It's very good for SHOs because you're commonly the people that will be prescribing contraception for postnatal patients, and it's very, very, very good for subgroups of patients and who is suitable for what kind of contraception. Kind of having a good knowledge of that website and the different guidelines in it is very, very useful. And equally, that guideline is examined on the MRCPI. So the next thing I would say to you is clinical examination cannot be underestimated. And that is probably one of the first things that I would study and have a good knowledge of early on in first year. So what I mean by that is like how to examine an abdomen, do an obstetric examination, how to do a vaginal examination, how to assess the lie of a baby, a fetus abdominally, how to do a vaginal examination, examine for station and all the different factors in a vaginal exam. I would advise, especially, if you're thinking about trying to get involved in labour ward or trying to spend time there, know the anatomy of the fetal head, know all of the different positions that the fetal head can come into the pelvis in. So, OA, OP, OT positions, you'll get those in textbooks. And you need to have a good knowledge of them and where the flexion point is, which is anterior and posterior fontanelle. There's a 9 centimetres line between them. The flexion point is 3 centimetres anterior to the anterior point of the posterior fontanelle. Now that sounds complicated, but it's basically just the top of the head, the very top of the head. So that if you put traction on the flexion point, the baby's head will flex and come in the smallest diameter possible. You should know the diameters of the fetal head and all the different presentations. So the OA diameter, the OP diameter, all the mento-anterior, mento-posterior diameters, they are all very useful. The other thing, I think if you're being really diligent and you really want to know your stuff, is you should study the female pelvis, like the bony structures of the female pelvis, the vascular and nervous structures there, and all the different courses of those arteries and vein and vessels, arteries and nerves. But all of that will be examined in the MRCOG. And that is really one thing that I took from the MRCG, is I knew that anatomy inside out. And that's really one thing that I would really hone in on for the MRCG part 1, is that you really know anatomy by the end of it. All of that kind of anatomy for your clinical exam, your obstetric exam, obviously I don't have a man for that, but if you know the theory behind it, that will empower you to do that properly and to do it safely. And like, its importance really just can't be stressed. And you'll find consultants still, their discussions or their kind of interrogation of a registrar will boil down to the basics of their clinical examination. So if you know your clinical exam properly and you can stand by it and know that it's reliable, then you can work safely, and then you can advocate for whatever you have done and the grounds on which you've done it. Sorry, I have just one last thing to say, and that's about your trainers. So many people who are so good at what they do, consultants, regs, everyone, midwives, everyone, follow it through. So the bottom line is, be reliable, work hard for them, ask them for help, and they will pay you back in spades if they think that you are really interested in doing your best for them and for their hospital. They will give you every opportunity. And that was definitely my experience at the Coombe. I worked hard there. I got so much great experience, research opportunities, to beat the band. Like, it was just phenomenal. BST in Obstetrics and Gynaecology is so enjoyable. I would just urge you to think about it really well. Kind of the first couple of weeks, you'll have an information overload, but really kind of step back and say, look, what am I going to get out of this? What is going to be my plan? And then kind of work towards that, and just enjoy it as much as you can. It's so enjoyable. And hopefully, if you're not turned off, you'll be joining me on the SBR then in a couple of years' time. So I wish you the very best luck. If you have any questions or anything, I'm always approachable. My email address is gillian.corbett@ucdconnect.ie. I'd be delighted to help you with anything. If you want advice on anything in the BST, if you want advice on exams or research or anything, I really would be delighted to help any of you. So do let me know. And the very best luck. Enjoy your first year, and I'll see you later.
Okay, so that concludes all the recordings. And so what we're going to do now is we're just going to ask some of the panelists to open their video, and we can take some questions as well. Okay, so there's one question here who's saying that they cannot see the e-portfolio and courses on Brightspace. Are they available yet? So the answer is no, they're not available just yet. We should have access for all year 1 BSTs next week. And what I'll do is once it's live, I'll just send you a quick email and let you know that you now have access. So was there any other? We only have that one question. Anybody else? I suppose, Dr. Clade, do you want to maybe say hello to everyone, and just maybe you wanted to add something to that?
Yeah, nice to meet everyone. It would have been nice to meet everyone in person. I suppose I'm new in this post as well, so we're in the process of kind of looking into what the contents we've already had on the course and the curriculum, and see how maybe we might have to change things a little bit in this kind of peri-COVID era. But you're all very welcome on board, and we try and make it to run as smooth as possible as we can for you.
I just want to point out as well that those courses, so they're all on the RCPI website, but I will be manually assigning you to 3 courses, and that's the leadership course, communications and ethics. So in a couple of weeks' time, I'll actually send you an email of dates of those course dates, but then all the other courses that are mandatory, you would just need to log into the RCPI website and just log in. There's one course that's up and running at the minute. I just checked it earlier, and it's the certificate in basic ultrasound. So maybe after this, at the induction day, if you want to log into the RCPI website, click on the BST courses, and you can book online there today.
Catherine, can I just talk there for a second? There's a couple of courses that won't be live for the next couple of weeks, probably not until the end of August, and that's because they're moving on the content online, and that's taken a little bit longer than was previously thought it would take. And I think it's probably going to be the leadership one and the ethics one. So although you may get an allocation date, you may not be able to register, but once you can register, we let you know directly that you can do that.
I just mentioned one more thing, actually. I know, I think I mentioned it earlier anyway, about the basic surgical skills course, about the suturing and the knot tying, but we'll be informing all your hub coordinators as well. So, you know, they'll be communicating with your trainers as well, but just to make sure you have the suturing and knot tying part of that basic surgical skills bit done and kind of signed off in the first few weeks. And then the rest of the contents of the basic surgical skills course we'll be looking at again to see, you know, what's the best approach to deliver all the contents.
Okay, so we have just another question here about the e-portfolio and how to log in. So, so currently you don't have access to the e-portfolio, so you would actually log in through the RCPI website. But because you don't have access to it, that link won't direct you into the logbook. So again, next week you should have access, and it would be through the RCPI website. And again, if you have any questions, you have my email address, and I'm going to send you, after this, I'm going to send you my presentation just with all the contact information. I'll send you your curriculum as well, and then I'll just send you the BST induction booklet, just so you have all this additional information. So, do we have any more questions, or is everyone just shy? Okay, so we'll leave it there. And again, congratulations and welcome. Again, you know my contact details, so you can contact me at any time. If you're having trouble finding out who your trainer is, just send me a quick email and I'll try and get that information out to you as quickly as possible. Welcome, and you know, look forward to working with you all.
Thank you.
Thank you.
We're just going to wait for everyone to go. Okay, I don't, people weren't listening there, but I had to remove them. So,
Oh, did you?
yeah.
You're just,
Sorry about my fiddling with the camera there earlier.
No, it's no problem. No.
Sorry, I wasn't sure if the audience were still there, and I was like, did I turn my camera on now?
It still says attendee and there's one, but there's no name.
yeah, there's no name there.
Anyway, it doesn't matter. Well done, Catherine. That was brilliant.
Yeah. So it went through okay, one after the other.
Excellent.
Great. Okay. Yeah.
So Aisie, we did 2 yesterday, and we didn't merge the videos the way Catherine did, and it was a bit more like 10 seconds in between where there was panic trying to press the button and everything. So Catherine just discovered a much easier way, and it worked quite well.
Was my one okay anyway?
Perfect.
Yeah.
Really, what we found is that so although the recordings, when they come through to us, they sound fine, but then when we start to broadcast them, the sound goes. So that was a bit of so we were trying to figure that one out as well. So it seems to be working fine now. You just have to press some button that we didn't know about. But yeah, it worked anyways, worked out fine. So yeah.
Thanks so much for organizing.
Yeah, so there was, how many was there? 26?
26, I think, yeah.
26 were there.
One at the end there. That including us.
Sorry, Aisie?
31, maybe including us actually.
Yeah, it's just the attendees box, yeah. So what there was 30 taken on, wasn't there? Yeah. So a couple of people didn't, which is probably expected, people on annual leave and stuff like that, yeah.
I think we're going to broadcast it, or we're going to play it back to them again. They have an option to watch it again next week, isn't it?
Yeah.
So anyone that wasn't able to attend, they can watch it again from next week.
I don't think there was much that I had to read anyway.
Usually there's more, well, you would think sometimes be more questions, but maybe the presentations covered everything. Like the 2 big questions really are, how do I get onto ePortfolio and how do I get onto mandatory courses, and the answer to them at the moment is you can't. So
about kind of just, I think I on that email as well, Maeve sent me an email that she found in her.
Yes, seeing that, yeah.
Looked, it implied that there was demo.
It's very hard to hear you there, Rosie.
Can you hear me now?
Oh yeah.
Like what it implied on that list was like we have videos and demos already. So I just asked Anne, do we have, what do?
Yeah.
I really want to be in a situation this time next year trying to
put them together.
Gather it together, to be honest. So, and if we have some videos, I think we can get them online and just kind of see what's appropriate to year 1, what's appropriate to year 2, year 3, and in the practical basis can actually probably be delivered at hub level.
Okay.
But anyway,
I think Anne was on annual leave. I think she's back now, so she'll probably answer in the next while. I'm sure she's a bit to catch up on.
What do you think about that little kind of survival guide or survival kit for?
I haven't even read to be honest, Aisie, because you've been
busy with all the
all the inductions. I seen it, but I didn't read it. Catherine, I don't know if you had time to read it yet either. No,
sorry. No.
We'll read it today or tomorrow.
I have a tendency of, what?
That's good, because at least we hear from you.
I hope you don't mind.
No, absolutely not. No, it's great.
Like I did ask some of the year 2s now, and they thought, that would be a great idea, really. Just even if we can include some bits of like how to navigate, like what you did there, Catherine, as in how to navigate through your logbook and all that, just based in that kind of survival kit. I think that would be sort of useful. But anyway, if it could be an app, it would be even better. But sure.
And like when you mentioned the word apps or anything, We just go, no, shut down. Happily do a document. Happily do a document. Apps. We don't have good relationships with apps.
Yeah. I think it'd be nice where everything is in it. But anyway, that's another day's discussion, I suppose. Great.
Okay. Azy, I'm off next week for the week. So first time I've had holidays in 4 months. So. And I'm literally going to go get my nails done. I'm going to get a facial. I'm going to sleep. Perfect. I'm going to go to Tato Park. That's all I'm going to do. It's well needed, I think, at this stage. And Catherine, you're the week after, are you?
Yeah. Oh yeah, can't wait. Yeah.
Well deserved. It's been a busy couple of weeks.
It's been hectic. Yeah.
Yeah. I'm in the office now. I don't know if you can see that. Like it's
really.
Yeah. I've been here twice this week. They're sick of me now.
Oh, really?
Because I thought like we had to clear our desks, you see, because they're redoing the office up, and I thought I'm a minimalist person. Catherine, I am a minimalist person. I'm like my desk is always immaculate and everything. It's taken 2 journeys to come in and get the stuff and bring it home. Because stuff you don't know if you can shred it or not. Like it's kind of annoying. So there's a few people here today, but so I think what we should do maybe is after everybody's had their holidays, maybe towards the end of August, we might have an actual meeting.
Yeah, I think so.
Yeah, that in number 6, like we can get into there no problem on Tuesday, Wednesdays, and Thursdays. So
open to that anyway. If you can let me know a little bit, like maybe a week or 2 in it.
Oh yeah.
I can kind of reduce my clinic or whatever. Just
perfect. Yeah, and we'll have a couple of agendas because we have a couple of things to follow up on, but nothing that's too much of a rush at the moment. I think that what we just need to do now is get the newbies up onto the systems, and then we can have a little rest.
Perfect. Thanks so much, ladies.
Okay.
Okay, thanks.
Okay.
Thanks, Azy. Bye.
Bye.
Catherine, just to say, like, brilliant job.
Well done.
Yeah.
Thanks. Glad it's over.
Bye.
See ya.
You're so calm with it, like you're bossy calm, if you know what I mean. Like you're like, no, this is what we're gonna do, and that's it. And I was like, fine, okay, great. So.
Well, it's the stuff they want to know. How do I work my e-portfolio? How, like all that kind of stuff. That's the only thing they ever ask. So I was like, I'm going to do an actual demo of where to find their forums and things like that. So hopefully that'll work and they have a bit of knowledge in that. But, I had to turn my sound off when I was on. I was just like, can't even listen to that.
And did you mute yourself and it didn't mute the video?
I turned down my volume.
Okay.
I turned down my volume completely.
So instead of muting, you turned down the volume.
So I was still,
you could still hear you. Yeah.
But I was like, I can't be listening to that. So I turned it off. Over there.
No, it was very good. It was very good.
Oh, just glad that it's done now, finished.
Yeah, that's been the best of the 3 of them done so far. So,
I didn't stay on for Milana's one because I just had to get back to mine. I was on it till 10 o'clock last night.
Oh, are you serious? No, Milana's was good, like, but I think histo was, we learned a couple of things from the histo and then able to, like Kerry's been there and they're going to do a hints and tips on Zoom, and I think I said we'll feed into it because I couldn't figure out how it's so seamless on the Wednesday workshop, but it's because either Shane or Adele are doing it. Yeah. So you chair it essentially, and you're doing the sharing. Whereas if you're doing that Wednesday one, you're just chairing it or you're sharing it. You're not doing both. Yeah. You know what I mean? Yeah. So it works quite well that way. But anyway, and then the fact that we hadn't got the correct access up until yesterday.
Yeah, no access at all, and we were the ones that had to figure it out for ourselves.
Yeah.
Like I had already told Adele last week about something else, and she was like, oh yeah, because I was like, I'm doing my induction day, so I kind of thought she would have given me full access.
Yeah.
then she just gave me creator, which doesn't help at all. It's videographer.
Same with me, because I had said I couldn't move Clena's videos into a folder, and she just done it for me. I was like, why? Like, show me how to do it.
Yeah, well, Kerry knows how to do it.
Kerry did it yesterday. She gave it to everybody yesterday.
Yeah. But we wouldn't have known that if we completely went in blind, thinking. Yeah. Anyways, it's lesson learned. We know how to work it now.
Yeah, but I'm reluctant as well to kind of say that, because it'll stick with us then from now on, you know. It's really weird, isn't it, talking to nothing?
Oh, it's awful, yeah.
Like, even the blank screens of the couple of panelists is not enough. Like, it's because you get absolutely no engagement back. Like,
nothing.
You know.
Well, I don't know about your screen, but when I was doing the screen share, I had no access to anything else, so I couldn't even see myself when I was talking in between.
So that's what I was saying yesterday. Do you remember when I was panicking yesterday, going, I couldn't see the chat or anything, like, you know, and I was like, oh, for God's sake, like, but it's because you have to exit full screen, but it takes about 20 seconds for that to happen. So so you don't even know it's sharing, because you can't even see if the right thing is sharing. Like,
you have no idea what you're sharing. You could be just sharing like a blank screen.
And still the video's playing for you, like.
Yeah. To you it looks fine, and then because also, like, I didn't see any of those chats coming up either for ages, and I was afraid to move anything at the start, and then I kind of started hovering around, and I could see that there was a little thing that said more. It didn't even say chat or anything, so I was just like, what the hell is that? So
same with me yesterday. I was like, I actually am afraid to move anything in case I stop it or stuff. And at one point I went into my emails and I was like, oh my God, can they see my emails? Because, like, if, you know, when you're in something and you try to share a next page, it won't let you do it. But that'd be the one time that they let you when you do something like that.
Because I didn't see Azy there at all, and I was like, geez, like, I need to email her or something. And I was like, geez, what if I go into email and they see
they hear you as well. Can hear you typing. Anyway, so we'll learn from it. I think May is worried, is she?
I don't know. I did offer to help. So like, I've logged out of everything now, so I log back in again and I'll see, do they want any help? But
well, I know I've asked Jane and she said no, she thinks they're okay.
Okay, grand. Well, I offered anyways, so I checked my emails now.
Do you want? Yeah, I was gonna say finish, and then you can slowly come in tomorrow if you want, if you don't have anything on.
And that's no problem. I'll take up on that. You don't even have to ask me twice.
I wasn't hardly finished the sentence there. Okay. Well, tomorrow's my last day then for the week. It's a pretty full day tomorrow, actually. From my point. Oh, actually, it's not too bad. I was thinking it would be. I'm doing the team lead interviews tomorrow. That's the only thing, really. So apart from that, I'm here if needed.
Yeah, I think tomorrow I'm just going to spend the day with all the e-portfolio stuff.
Yeah. Okay.
Because I just want to get that sorted, because that's just on the back of my mind.
Yeah, Okay, grand. Have a lovely evening. Well done. Bye. Bye.
Bye.